All right, thank you so much, Felix Manudo, for giving us a sports update. You do have the cricket national team trying to make its stance and put itself on the global map as far as cricket is concerned with an international competition. But they are not the only ones that are under pressure. We are also under pressure with different candidates for different electoral positions. Also wanting to come before us and campaign as to why they are the better candidate to represent us at the different elective positions come 2026. But amidst all that, we are looking at campaigns. We're looking at multiple gatherings ever so often, day in, day out. But there are risks that we must also address. So this morning in our Tech Note, we're going to look at the potential health risks during campaigns and what precautions have been put aside to ensure that everyone is actually sensitive, not just to what that candidate is telling you, but what health risks are actually before you as you are listening or engaging with that candidate. Mass gatherings having entailed the presence of large numbers of individuals in a given venue at the same time and having the potential to actually amplify the spread of different diseases, including mpox and others. And so we want to look into this new season that we are embarking on, the election season. Campaigns are underway. The risk of health is increasing as people continue to gather in larger and larger numbers. How do we avert some of these health risks? Well, we do have the Senior Communications Officer with the Ministry of Health here to help us understand what are the current risks that we are faced with as a nation and how they can be averted through this electoral cycle. Her name is Marion Natukunda, and she's going to be giving us a better understanding of the position of the Ministry of Health on these health risks. Good morning to you.
Good morning, Priscilla, and thanks for having me here.
It's a pleasure to have you. Yeah. Now, when we talk about elections, we're talking about people gathering to hear, to see for themselves, to judge, and to uptake of what is being committed unto them by, the people that want to represent them in the different elective seasons. And so we get to see that this stadium will be full, the church will be fuller, the schools will be engaged. All communities and all social gathering forms will actually be having capacity when it comes to numbers. But in that, we are definitely looking at some health risks that could come out of it. What are some of those that the Ministry of Health is focusing on?
Thank you, Priscilla. And I like that you brought to that angle whereby the public has to be cautious, and also the season we are into campaigns, elections, and we're also getting into the festive season very soon. So I think that what Ministry of Health does, by the way, in these kind of instances, we normally go to the public and to the masses and just tell them, hi, guys, be cautious. Be cautious. One, we have to be each other's keepers. That's number one. Number two, there are a bit of diseases that are still around. I know the public is still, I don't want to say denial, but we know that COVID is there, though it is mild. And most of the people that are being affected by COVID or that get COVID of recent, and that can be so severe, are those that didn't take the vaccine. Because still we have people who don't believe in the vaccine. And besides, it's their opinion and it's their health and it's their choice at the end of the day. But as Minister of Health, we preach and say, guess what? It's there. You just have to be precautious about it. Then of course, right now we also have mpox, and mpox also deals with crowds. And that has been happening for a while now, from late towards early, I think mid 2024
into July, August.
Yes, into 2025. And the cases have been we have had about 8,000 cases, and unfortunately we've had about 50 deaths. But this also has to do with crowds, and you never know, because I come to you, we stand, we cheer for our leaders, our local people, and you do not know what my neighbor or the person I'm standing next to is suffering from. And we are still telling the crowd or the masses out there that if you're not well and you want to go into the crowd or into public, please put on a mask. But I also want to applaud Ugandans that most of the places I have been to, either it's a meeting, either it's these shows that we have, some of them, you see that some are putting on masks. And sometimes I ask them, you're not well, right? What are you suffering from? It's like, man, I have this bad flu. And I want to be here and have fun, but I cannot afford to infect others. And they're putting on masks. And I want to applaud people that they are there. But of course, there are those who are not. And that is one thing we are encouraging.
Okay.
Yeah.
You have mentioned that COVID is amongst us still. This is an airborne disease.
Yes.
Let's talk about mpox particularly, especially when it comes to, masses and crowds. What are the symptoms that people must look out for while they're engaging in public affairs?
So, the symptoms of mpox, first of all, I want us to understand what is mpox. Mpox is a viral disease caused by the mpox virus. I'm not a scientist, so I won't delve more into science. But it is similar to smallpox. Remember smallpox? When we were young, we got smallpox. And it is mild. It is not as strong as smallpox. I remember when I got smallpox, I was at university. And trust me, it was not a nice thing.
Yeah.
And guess what? I was working with Tasso then. And do you remember the stigma that was around people working in Tasso, or there was a lot of that was the HIV and all. So I would go to school, and they would tell us smallpox, you have to put on some powder or Colgate or something. So I was really stigmatized. And my friends would not talk to me, my classmates would not sit next to me. And they would be like, but this girl, first of all, she works with Tasso. She's being dropped in a Tassoka, which was just a transport to university, and I would come in the evenings. So now, and we know that smallpox was so harsh on your body. Now for mpox, it is mild, but it comes with strong. It spreads through contact with an infected person. If the person, and sometimes people do not know that they have that, or animals or contaminated meat, and materials. But also when it comes to symptoms, like you asked, is fever, headache, muscle aches, and backache. And I know people are going to say every day someone gets fever.
Yeah, and
sometimes I feel my body and my muscles are hurting. Maybe I have fatigue. And you see, we also have a problem. We do not like to go for medical checkup.
Right.
It is when someone is literally crawling in pain that is when they remember to go for. Just last week I did a checkup, and I've been having a series of headaches, and I was like, but why?
What's the root cause?
What is the root cause? And every time I'm in pain, I will walk to the nearest facility
and pick up a painkiller.
And just no, I'll go and do a test. I cannot preach and then I don't do what I'm doing. So I walked into a facility and I took a test, and I realized that I am actually okay, but it was just my HB that was down. Yeah, like anemic kind of. And I was like, but I've been taking all these things and all. But it is good to know your status.
Okay.
Yeah.
All right. So in the case of mpox, you've mentioned it being a viral disease, but then when it comes to spreading, it can easily be spread from one body to another. Talk to us about those particular symptoms in line with the fact that people are going to be engaged in public, engagements, and being in so many people, rubbing shoulders, shouting, spit all over. So, the fact that it is one of the things that you get a rush, and it is rushy in a way that you get tender chills, and it has spots in areas of the hands, the face, the feet, chest, and genitals. And if you notice, I've talked about the hands because we touch each other, so you can easily give it someone. The face, you'll see it because like I said, it's rushy. Now, when I say genital, we all know that sometimes we get excited and indulge in sexual behavior and all. And it's also transmitted because, remember, it is contact to contact, body to body. So you would not know. And like I said, the symptoms are mild. And depending on how long that person has had them for, it is easier for them. And one problem that we have, sometimes also we look at enjoyment first and then we disclose it next, later, you see. So a fever, we all touch and you're sweaty and all that. Maybe now that is when you mistake it for malaria or anything. But it can also be mpox without us knowing. Okay.
Yeah.
All right, that's very interesting. Talk to us about the current risk assessment for mpox in Uganda.
The fact that The current risk assessment for the mpox in Uganda, one, like I said, it's not everywhere. Right now, it is running in a few districts, mostly the western part of the country. And like I said, it is so the cases are case-to-case basis. So like in the last 24 hours, we had about, let me say we had about 4 cases, and it is just the cautiousness of public that someone now, because they know the symptoms, and then they start telling you, guess what, Priscilla? They make a phone call to us or a call center and say, which is very, very active by the call center right now, and they say, I think we've seen someone with the symptoms. Do you remember how people used to call for COVID and say, there's someone here seated next to me, and they are coughing, and they don't want to cover themselves. You tell them to move away, so you report the case. Where you give the case, you give the person, the description, and then someone is there. So our response system is so fast, and the fact that we know that this thing can really spread. So the risk assessment is not very high, and the public shouldn't worry about it. The cases, like I said, actually there are 15 cases in the last 24 hours, which you see is not that high.
Okay, all right. But nevertheless, people should have precautions, especially candidates and their supporters. So what are some of those health precautions that you are trying to put out there as the Ministry of Health to ensure that both candidates and supporters are actually safe?
So, and that we call it prevention. So one of the things is that one is we have to avoid contact with someone that you think has the symptoms I mentioned. That's number one. Also regular hand washing. And I want to really employ our candidates that are standing for all the posts, and starting of course with I know that the president of the Republic of Uganda is very cautious when it comes to he's always having a mask when he's in when he's in public, and has a sanitizer, and he has all these people around him that are protecting him but also protecting themselves. But let us get down to our local communities, our MPs, is that when you're out there, just tell guys, there's even when you're going to set up your rally, put there washing hand washing facilities, and it is simple. It is just a basin, soap, and a jerry can. I know we can't afford these dispensers that bring out the water, but a jerry can is okay. And now we even made it easier. You have a tip tap where you just put your foot and water comes out. But what am I saying? Washing hands. And if you're in the crowd for long, have a sanitizer on you. Now we have very many small pieces of sanitizers hanging around. Then also do not share beddings. In the event that you have cited symptoms of what I mentioned earlier on, fever, rashy, and fever, do not share beddings, clothes, utensils with these people that have the symptoms. Another thing is animals. We keep a lot of pets in the house. We are a country that has animals and whatever, and bushmeat. We know there are cultures or whatever that eat bushmeat. Sometimes you have to avoid that because you do not know what you're contracting from that. Lastly, of course, wear protective gears, the mask, and if you're treating and you're in a health facility, you put on a mask. And most importantly, our lines are there, hotlines are there. Just pick up the phone and report the suspected cases that you think are there to the nearest facility. And like I said, never underestimate anyone saying, I have this, I have that, because you are actually either saving a life or saving yourself. Okay. Yeah. All right. So as mpox as an epidemic is spreading, how is the Ministry of Health spreading this precautious methodologies so as to ensure that the message reaches all, especially in Western Uganda, while they're engaging in this campaigning season, people can be kept safer? Yeah. One, I think we are here, me and you, talking about it. And then two, we have regular discussions on radios, especially the radios, because we know they reach further, and not everyone watches TV until they get home, probably around maybe in the morning now, and then 9 p.m. and all. And then we have what we call community dialogues that are continuing, but we have dubbed them barazas. You know what a baraza is? Yes. Baraza, you sit on your baraza and you have this discussion. So we're going home to home, but also working with our district, our community health extension workers, our village health teams, whom we have equipped with a lot of information, both hard copy and also on information on where they can go on radio and talk about it in their communities. And we're telling people listen to your local leaders because they have been equipped, but even us, sometimes we have those barazas. I know when someone receives me coming from the Ministry of Health going to down to Mbarara or going to where they know that, by the time a ministry person has come, it is serious. So we have that engagement, all from the local level until the national level.
Okay,
yeah.
All right. Now, of course, some people may take heed to the message you're passing on, some may not. And then that means that infections may increase. How prepared is the Ministry of Health to handle these cases, just in case we see a spike?
Yeah, thank you. Our surveillance team we have a fully fledged surveillance team that is anytime, 24 hours in the public. Anywhere you call, you'll find them. Number two, we have what we call the risk communication team that picks up all these, that has a hotline where we pick up this information and then we attend to it there and then. Two, again, like I said, our hotline at the call center is one. And also we're working with partners, UNICEF, WHO, and local civil society organizations and CBOs on the ground who know our call and then they call us. But as I work in the health promotion department as the senior communication, and we have someone who is really in charge of this. And when they are called, because sometimes you can call the hotline and it is so busy. So we have a number that you can dial on and they will just run to the field. So that is, we're readily there, but our emergency and surveillance team is on the ground 24/7.
All right, you have spoken of the hotline that people can call to actually report some of these cases or incidences. What is that hotline?
Our hotline is, allow me to read it, it is 0800 100 066. Our hotline, if you want to talk to us and ask more about what is happening and the cases or report a case, is 0800 100 066. And that is our hotline. You'll get our people ready and it is 24 hours.
Okay.
Yes.
All right. Your final remarks and your call to action, especially in behalf of the Ministry of Health.
I think my call to action will probably closing remarks. First of all, vaccination helps high-risk areas, and we have the vaccine. Two, Mpox is real, but it is preventable. It is real, but it's preventable. We just need, one, to protect yourself, protect our families, protect our communities, and let us be each other's peacekeepers. We were in COVID, and we conquered. So I think with the many diseases, I don't want to really dwell much on Mpox as much as it is there. But we also have malaria. People are dying of malaria. My age, your age, we're now dying, not even kids anymore. So I employ people just to be preventive and also look out for each other.
Okay, all right. Marion Natukunda, Senior Communications Officer with the Ministry of Health. As the ministry, they are really asking you to be cautious as you do engage in public activity, being mindful of some of the health risks that are on the national spotlight right now. Mpox being one of those. That brings us to the end of this discussion.